Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years.
Hello and welcome. Today's presentation, Managing Diabetes During Challenging Times, is presented by Luanne Sadueste. Luanne is a diabetes educator at Washington Hospital's Outpatient Diabetes Center. Without further ado, please welcome Luanne Sadueste.
Good evening, everyone. My name is Luanne Sadueste, and I am one of the Certified Diabetes Care and Education Specialists here at Washington Hospital. Tonight, I'm going to be talking about managing diabetes during challenging times. So you're being asked to stay at home, social distance, stay 6 feet apart, but also at the same time, find time to exercise and prepare diabetes-friendly meals. This is also a time where a lot of families are facing financial hardships, and they have to decide whether they can buy healthy food or buy much-needed medications or medical supplies to help control their diabetes. This, in turn, causes stress and anxiety. So it's not that people with diabetes are more likely to get COVID-19 compared to the general public. Instead, those with diabetes face a higher chance of experiencing serious complications if they do get COVID-19. According to the American Diabetes Association, out of all the COVID-19 deaths, nearly 40% of them had diabetes, while 90% of hospitalizations have been with people with diabetes or some other underlying conditions. With that said, the time to manage your diabetes is now. Please do not use the excuse as the pandemic to relax your diabetes management routine. We definitely know that if you do get COVID-19 and you have diabetes, you can develop life-threatening COVID infections. You are also at increased risk for developing ketoacidosis, or too much acid in your blood, which may trigger hyperglycemia and cardiac disease and nerve damage. Some other statistics when it comes to diabetes and COVID, 43% of people say that they've delayed seeking regular routine medical care because they fear exposure to COVID. Please do not miss your doctor's appointments. Please don't stay away from the hospital because you fear getting COVID. We here at Washington Hospital have taken extra precaution to stop the spread of COVID-19. So we are open and we're here to help you. 1 in 5 people say that they've foregone or put off getting the technology that they need to manage their diabetes. This is usually due to financial constraints. 12% of people with diabetes have seen their health insurance disrupted. And of those who are newly without health insurance, 19% are forced to go on Medicaid, and 13% have become uninsured. So today, I'm going to talk about addressing these 3 topics on how you can effectively manage your diabetes. First, I'm going to talk about difficulty accessing medications, finding fresh, affordable food, and being physically active due to shelter-in-place mandates. Medications. Please don't stop taking your medications. Don't stop taking your insulin, even if you cannot eat. Take your medications. Make sure you have a good supply of your diabetes medications at home. If you cannot tolerate your medications or you fear taking insulin because you cannot eat, please contact your healthcare provider. Think about what you would need if you do need to self-quarantine. Consider requesting a 90-day supply of medications instead of a 30-day supply. Or you can use a mail order prescription service to avoid any unnecessary trips to the pharmacy. Now, when it comes to insulin, there is no shortage of insulin. And all of this information here can be found on the American Diabetes Association website. Or you could go on insulinhelp.org, or you can call 1-800-DIABETES. That's 1-800-342-2383. Press 0 and you could talk to a person Monday through Friday from 9 to 7 p.m. Now, when it comes to insulin, the most affordable insulin for you depends on your insurance. Just know that all the fast-acting insulins, Humalog, Novolog, Apidra, Admelog, can be substituted for each other. So I'm just going to take, for example, if you have Alameda Alliance, since we live here in Alameda County, if you have Alameda Alliance, the preferred insulin is Admelog for fast-acting insulin. So if your healthcare provider has prescribed you Humalog or Novolog, talk with them to see if you can switch insulin types. Now, when it comes to long-acting insulin, Lantus, Levemir, Toujeo, Tresiba, same thing. All long-acting insulins can be substituted for each other. So with Alameda Alliance, if you have that insurance, the preferred long-acting insulin is going to be Bisaglar. Now, you could also go to the manufacturer themselves. There is Lilly Insulin that makes Humalog, and if you have no insurance or you have commercial insurance, you can purchase Humalog insulin for $35 for 1 month's supply. If your insulin is made by Novo Nordisk, they do provide a patient assistance program. It's free one-time immediate supply for up to 90 days for patients experiencing financial hardship due to COVID-19. For patients without any insurance, you can take part in Value You Savings Program, where you can get insulin for $99 for a 30-day supply. Now, I don't recommend getting insulin without a prescription, but if you are in urgent need of insulin, you can go to the pharmacy and get Novolin N or NPH insulin, or Novolin R regular insulin, or Novolin 70/30 mix. You can get all of that without a prescription for $25. Now, they offer this because we know that insulin is a life-saving medication. It is recommended to work with a healthcare provider to see how much dosage you should take, but if you are in need, urgent need of insulin, you can go to the pharmacy and ask for insulin without a prescription. Now, when it comes to diabetes supplies and medications, the pen needle that attaches to the insulin pens shouldn't cost you more than $9 for a 50 count. For syringes, you can get 100 syringes for about $13. Now, when it comes to glucometers, much like your insulin, there's thousands of brands out there when it comes to glucometers, and the best glucometer for you really depends on what insurance you have and what they cover. Now, again, if you have Alameda Alliance, the preferred glucometer is going to be a freestyle glucometer. Now, you can also get a glucometer that is over the counter for about $9, and you can get about 50 test strips for about $15. Now, when it comes to your generic medications like metformin or your sulfonylureas, glimepiride, glipizide, glyburide, it's going to cost you about $4 to $9 for a 30-day supply. If you're on a non-insulin injectable or a GLP-1 like Bydureon, Ozempic, Trulicity, Victoza, they all offer assistance programs, copay cards, and patient assistance programs. Again, if you want to find any of this information, you could go on the American Diabetes Association website or insulinhelp.org. Now I'm going to be talking about how the pandemic has dramatically reduced access to food. About 12% of the general population is experiencing food insecurity. More than 1 in 4 people reported that the pandemic has disrupted their ability to get healthy food. Nearly 1 in 5 say that they must now rely on some sort of a nutrition assistance. Nearly half of those who do rely on nutrition assistance say that the food that they're getting is not good for their diabetes. Nearly 1 in 5 say that since the pandemic, they now have to choose between buying food or buying medications and medical supplies. There is help out there. There's CalFresh, which is a nutrition program that helps you get fresh food, vegetables, and whole grains that you need to stay healthy. You do have to go online and fill out an application, and the amount you get really depends on your income, expenses, and family size. Most households get about $200 each month. There are food banks and food pantries available, and this one's through Tri-City Volunteer Food Bank, located here in Fremont on Joseph Street. They have a drive-through pantry that's open Tuesday to Friday from 9:30 to 3 o'clock. They don't have a registration process. If you are in need of food, you can go drive through their system and get groceries 1 time per week. The clients can expect pre-bagged mix of healthy, nutritious food, including seasonal fruits, vegetables, whole grains, cans, and boxed goods. The availability is really based on donations and what season it is. You are expected to stay in your vehicle, wear a mask, pop your trunk, and the volunteers will place the food in your car. In Newark, the League of Volunteers has a homebound emergency food pantry delivery. They're serving residents of Fremont, Newark, and Union City. You can get a box of non-perishable food, about 25 items per box, and it's 1 box per family, and you could come in and collect it monthly. If you want to find out more information, you could go to their website, lov.org, or call the phone number 510-793-5683. If you live in Hayward, through the South Hayward Parish, they have a food distribution Monday, Tuesday, Thursday, and Friday from 2 to 4 p.m. If you want to find out more information, you could go to their website, or you could call the phone number 510-785-FOOD. Now, they also have a Salam food pantry where they distribute grocery bags from 10 to 1 p.m. every 4th Saturday of the month. They even provide hot meals on Saturdays from 11 to 12:30. If you have children ages 2 to 18, the Fremont Unified School District is serving free breakfast and lunch on Monday, Wednesdays, and Fridays. Please note that your children do not have to be present when you pick up the food. All of the locations are listed here. It's elementary schools and high schools, and the times of operation is Monday, Wednesday, Friday, lunchtime 11:30 to 1 p.m. Meals on Wheels. It's a delivery program for our seniors, 60 years of age and older, who are homebound and unable to buy or prepare meals. Seniors can receive meals Monday through Friday and frozen meals over the weekend. So you would just call the following phone numbers and see if you qualify. If you live in Fremont, Newark, Union City, you would call 510-894-0370. Regular physical activity. And now we know the benefits. We already know the benefits of exercise, especially when you have diabetes. It does improve your response to insulin, also lowers your blood glucose levels, lowers your blood pressure and cholesterol levels, controls your weight, and reduces your risk for developing diabetes complications. Every year, the American Diabetes Association publishes what's called a standard of medical care in diabetes. And for this year, 2021, here are their recommendations. They do recommend 150 minutes of moderate to vigorous aerobic exercise per week with no more than 2 consecutive days without activity. This is spread over 3 days a week with 2 to 3 sessions of resistant exercise. The key thing is to interrupt that prolonged sitting. So if you find yourself sitting down for more than 30 minutes, give yourself a break, stand up, walk, do some leg extensions or overhead arm exercises every 30 minutes. Now, before you start any exercise program, you do want to talk to your doctor to determine the type of exercise that's best for you. Your doctor might need to do a stress test or a pre-exercise assessment, especially if you have cardiovascular disease, peripheral vascular disease, neuropathy. If you do start to exercise, make sure you drink a lot of water. Drink water before, during, and after exercise. You want to plan ahead, especially if you're on insulin. Talk to your healthcare provider. They might suggest to take less insulin or eat a snack that contains carbs before, during, or after exercise. Especially if you have type 1 diabetes, you might need to check your ketones, and if you have large or moderate to large amount of ketones, you might need to defer exercise for that day. Safety first, so you want to check your blood sugars, especially when you have diabetes, before any vigorous exercise. If your blood sugars are less than 100, you can eat a snack containing 15 to 30 grams of carbohydrates before you begin. If your blood sugars are too high, 250 and above, you might need to check your ketones. It's good to exercise with a friend or a partner for safety and motivation, but if you're going to exercise by yourself, for safety, please wear a ID bracelet or a necklace, because we do want you to prevent from getting low blood sugars or hypoglycemia. And hypoglycemia can occur after a long, intense workout. If you skipped a meal before starting to exercise, it can even happen during your activity or up to 24 hours after physical activity. Again, you want to plan ahead. Make sure you have your glucometer or your meter to check your blood sugars, and have your glucose tablets. And just think of the rule of 15. Know how you feel when your blood sugar starts going down. A lot of patients feel tired, shaky, sweaty, dizzy, lightheaded. Any of those symptoms, check your blood sugar. Less than 70, you need sugar. Glucose tablets would be best. You would take it, wait 15 minutes, and then recheck your blood sugar. Once it does go above 70, you can eat a snack. Please take care of your feet. When you have diabetes, they say to take care of your feet more than your face. You want to wear good, comfortable shoes. Wash your feet every day. Check the bottom of your feet for any open wounds or sores. Now, when it comes to exercise, we got to think about those barriers that we all face, and I face them too. I always say, oh my goodness, I don't have time to exercise. So if you feel like you lack time, what you can do is schedule it, put it in your calendar, and be intentional and prioritize it. If you get bored easily, come up with other activities that you might like. Okay, if you have trouble staying motivated, just make sure you just don't overdo it. Set up targets for yourself. And if you need support, maybe you can ask your friends for like a friendly competition. Other options is to work out virtually or just the main thing is just to plan to stand up and move around every 30 minutes. We just want you to be active as possible. Walking is a great exercise. In general, when you walk, 1 minute of walking brings down your blood sugar 1 point. If you don't want to go outside and enjoy this beautiful California weather, you can stay inside and exercise. There's lots of videos via YouTube. You could take the stairs or just march in place. Just try to find any extra activity. If you find yourself just talking on the phone or texting or during commercials, just walk around, especially after a big meal, do chores, park further. Maybe you can even make your family outings as active as possible by biking, hiking. Make it work for you. Know yourself. Find out what you like. There's tons of Zoom classes online through Silver Sneakers. If you're 65 and over, you can go to the gym for free, just as long as you sign up for that program. They even have yoga online too. If you work from home, you could purchase one of these through Amazon. You put it under your desk, and that way you can sneak it into your day while you're working from home on your computer. You definitely just want to hold yourself accountable. Take a class. Again, put it in your calendar. Commit to a virtual charity event. They even have marathons where they give you a shirt and a medal for participating. Tell someone your plan so that you could set yourself up to succeed. Remember to start slow and be realistic. What you can do is come up with a SMART goal. So you want to be specific on which exercise you want to do, either walk, jog, or bike. You want to make it measurable. So for how long? 30 minutes. You want to make it achievable and realistic, right? If you haven't exercised at all, you're not going to say that you're going to run a marathon, 7-mile marathon. So you want to make sure that you can achieve it, and you want to make it timely. So you're going to say, I'm going to start walking for 30 minutes every other day starting tomorrow. So when you have diabetes, you do want to make sure that you have a sick day plan. So in case you do get COVID-19, or if you get the flu or a cold, a sick day plan follows the standard sick day rules. So just be prepared just in case you do get sick. Just know a lot of the over-the-counter medications can affect your blood sugar levels, especially the cold and flu syrups or any pills that contain the same ingredients as syrups. Even decongestants and ibuprofen can affect your blood sugars. When you do get sick, it does put added stress on your body, and you can have high glucose. So it is recommended when you do get sick to check your blood sugars more often, every 2 to 4 hours. Try to eat even a small amount, even if you really don't feel like eating and you have no appetite. Try to drink a small amount of carbohydrates every hour. Drink plenty of sugar-free liquids. And if you live alone, please have a family member or a friend check up on you. Pay extra attention to your glucose. Again, when you're sick, check your blood glucose every 2 to 4 hours. If you're not on insulin, it's recommended to check your blood sugars at least once a day. Now, here are the goals for when you do check your blood sugars. Before eating, it should be 80 to 130. 2 hours after eating, it should be less than 180. Your doctor might have individual goals for you, but in general, these are the target blood glucose levels. If you are on a continuous glucose monitor, what they're looking at now is time in range, and the goal is to have your blood sugars be 70 to 180 more than 70% of the time. When it comes to low blood sugars, it should be less than 4% of the time. And when it comes to high blood sugars, over 180, it should be less than 25% of the time. Again, drink lots of water, increase your fluids. If you're sick and tired of your water, then add lemon, lime, or cucumber slices. You can even try sparkling water. You do want to go easy on those caffeinated beverages like coffee and tea, and on the sports drinks too, mainly water. Now, if you do get sick, you're probably thinking, what can I eat when I really don't feel like eating? All of this is examples of food choices that contain about 15 grams of carbohydrates. Also, if you do get sick, your doctor might ask you to check your ketones. If you have type 1 diabetes, you want to check your ketones every 4 hours. If you have type 2 diabetes, you can check your ketones as often as your healthcare provider advises you to. Now that if you do get sick, now you're probably wondering, when do I call my doctor? When your blood sugars are too high, when your glucose is more than 300 times 2, or when you're unable to keep fluids down, you're having diarrhea or vomiting for more than 6 hours. You want to also call your doctor if you're not tolerating any of your medications. Know the signs of dehydration, dark urine, dry mouth, lethargy. This could be signs of diabetic ketoacidosis, or DKA. That's the time you would need to call 911. Also, keep all your emergency contacts updated just in case you get ill. Again, if you live alone, make sure someone you can rely on knows that you have diabetes and that they're there for you if you require any assistance when you do get ill. If you need help, we are open. Washington Hospital's outpatient diabetes program is open. We offer classes, via Zoom or in person, or you can make individual appointments in person or via Zoom or telephone. You do need a referral from your primary care doctor to get this service, and most insurances cover diabetes education. If not, we do have a free support group that's every first Thursday of the month at 7 p.m. via Zoom. And every other month, we have a free Diabetes Matters classes where we have expert speakers talking via Zoom. Next, Diabetes Matters is on April 1st at 7 p.m. and one of our nurses, Joyce, will be talking about glucose monitoring. So if you are interested and want to be part of the distribution list, you can either email diabetessuccess@whhs.com or call 510-818-6556. Managing diabetes is challenging, and even more challenging during a pandemic. Just know that every step that you take to control your diabetes counts. With blood sugar control, you can prevent or even prolong those long-term effects of diabetes. Research shows that blood sugar management can reduce the risk of eye disease, kidney disease, and nerve disease by 40%. Blood pressure management can reduce the risk of heart disease and stroke by 33 to 50%, and decline in kidney function by 30 to 70%. Cholesterol management can reduce cardiovascular complications by 20 to 50%. Regular eye exams and timely treatment could prevent up to 90% of diabetes-related blindness. Regular foot exams and patient education can prevent up to 85% of diabetes-related amputations. These are my references. I'll still be here to answer any questions.
Thank you, Luanne. First question. Before the pandemic, I was at risk of having diabetes. I have not seen my doctor in over a year. Now I'm really concerned because I'm feeling really tired, always thirsty, and most alarming, my vision is blurred. Should I see my doctor? And if so, is it safe?
Definitely. Those are classic signs of diabetes, which is going to the bathroom a lot, thirsty, dry mouth, and you should definitely see your doctor. I'm sure your doctor's office is open. Washington Hospital is open, and we have taken a lot of precaution to make sure that we can stop the spread of COVID. We all have to wear masks and get our temperatures checked. So you please see your doctor, especially if you're having those symptoms.
Thank you for the food pantry information. You mentioned in your presentation the food that they offer is not very good for diabetics. What is your recommendation if I still need free food?
Well, there are a lot of food pantries and food banks around. Maybe the best you can do is, just shop around, read the label. You could still have carbohydrates. It's really about portion control. If you need help, please talk to a dietitian. They can even come up with an individual meal plan where you can have the food that you have, and then you can use the plate method or read the label to make sure that you're not overdoing it when it comes to carbohydrates.
So gyms are opening up again, and I haven't been very active during the pandemic. I'm worried that I may crash during a workout. Is it safe to have a small snack, maybe in my car, before heading into the gym?
Oh, definitely. Yes. That's why it's good to plan ahead when you exercise. That way, if you do need a snack and you do need to check your blood sugars, especially if it is less than 100, it's recommended to have a snack that contains about 15 to 30 grams of carbohydrates before you begin.
Our last question. When someone has severe foot pain, is there anything they can do to still exercise?
Yes. Well, all my patients who have diabetes, they should see a foot doctor if you're having any foot pain. But there's tons of exercises that you can do that doesn't put a lot of pressure on your feet. You can go swimming, you can go biking, but if you are having problems with your feet, again, take care of your feet more than your face and see a foot doctor, especially if you have any open wounds or sores. Don't do any surgery yourself and come in and see your doctor.
This concludes our program. Thank you, Luanne, for your expertise, and thank you to our viewers for tuning in. The entire broadcast of today's event will be available on Facebook and YouTube.